I can tell you she recently accomplished her first marathon gracefully, and she did a great job, and we've enjoyed watching her grow into this role as well. Sarah's done this presentation before, last time we did this symposium, and she's going to tell us everything we need to know about a heart-healthy diet. And thanks again for being here.
Yeah, thanks for having me. All right, everyone. It's really good to see you all, and I am so happy to have this pleasure of talking with you. So as Dr. Wells said, talking about general heart health today and how nutrition plays a role. I'm Sarah, and I'm working on more the Emory University side of things. So a lot of the people you've heard from today are on the hospital side. I'm on the university side, working in the student health clinic, just for a little bit of background. To give sort of a lay of the land for what we're going to be talking about today, I wanted to highlight a few different nutrition strategies that you can take into consideration for how you might approach your own nutrition. Now, as we go through them, you're going to notice there's going to be quite a few similarities between them, so don't get hung up on those. My point for bringing up a few different kinds is so if one of them resonates better with you, that's wonderful, and I recommend that that's the one that you can follow. So I will also close out with some conversation on special topics like stimulants, alcohol, and supplements. But before we dive into those nutrition strategies, I really wanted to start off with first explaining why nutrition is important in the context of today's conference. Why is it important in relevance to the conditions we're talking about today? So I want to say right up front that nutrition is not necessarily going to be a cure for FMD or SCAD, and it may not directly affect the presentations of those conditions. However, the wonderful thing about nutrition is that we can promote overall health and general heart health with that practice. So that's where I'm coming from today, especially through the lens of things like blood pressure and hypertension, cholesterol, atherosclerosis, diabetes, all of that you'll see kind of referenced in throughout my slides. So that's why we're talking about it. So the first approach I wanted to highlight was that of the Mediterranean diet. It is likely you have heard of this before, and I like to think of it actually as more of a lifestyle because it's not just a diet in and of itself, and naturally gets its name from where it's derived from in the region of the world. The reason why the Mediterranean diet likes to get so much attention is because of some of the health benefits that are seen in those who follow such an approach. So generally improvements in blood pressure, cholesterol, potentially weight loss, depending, reduced risk of diabetes, and increased lifespan. So that's a little bit about why it gets so much time in the limelight. In general, people who tend to follow a Mediterranean diet have increased consumption of your expected food groups, like fruits and vegetables, seafood, your healthy fats, which are unsaturated fat in nature, such as olive oil, olives, avocado, nuts, and seeds, and your whole grains. In addition, it would be lower in other types of food groups, like things that are high in saturated fats and trans fats. So the things that come to mind for that would be things like fried foods, red meat, baked goods that are high in butter and things like that, and also low in added sugar. So as you can see, this is more high level. It's a nice little overview of what's going on here with the Mediterranean diet. There's not necessarily a very structured, very specific way of communicating this, which is why I also wanted to highlight the DASH diet. Because if you're looking for a little bit more direction, a little bit more guidance, maybe this is one that could be fitting your needs better. Now, the DASH diet is what we call it in short, but it's the dietary approaches to stop hypertension. Most of the time you hear of it, it's called DASH diet. As you can tell, this one is actually made for managing a medical condition. Now, the nice thing is that while it's designed to help with blood pressure, it can also help with things like cholesterol, risk of stroke, and risk of heart disease as well. So it can kind of catch a lot of important pieces of our health in addition. Now, on the next slide, we're going to go into more specificity as to what makes up the DASH diet, but totally out of curiosity and for a moment of levity here, if 2,300 milligrams is the recommended daily limit of sodium, how many milligrams do you think Americans consume on average per day? Did I see 8,000? Or I thought you meant 8,000 times. I was like, wow. 3,000, okay. Okay, 5,000, definitely hearing a wide range here. Now, I didn't expect anyone to like have this perfectly on the dot, but it was just to bring some attention to this point. So in general, and I actually think this is kind of generous. I know, right? I think this might be a little low for some people, but in general, it's about 3,400 milligrams, which is 1.5 times the general recommendation for heart health. So just something to kind of keep in mind there. And a little fun fact is 2,300 milligrams is 1 teaspoon of salt. It's pretty small, right? So important to keep in mind how much sodium we consume on a daily basis. Now, if you want to take this one step further, they actually recommend further reduction to 1,500 milligrams of sodium for additional heart health benefits and management of blood pressure. So that's something to keep in mind. Very much like the Mediterranean diet, like I told you earlier, is that you're going to see those same food groups, same general recommendations pop up for what to eat more of, what to eat less of. The DASH diet gives a little more specificity in terms of number of servings you can reach for per day within those food groups. So if you're someone who likes more specificity, here you go. But keep in mind that what you see here is based on a 2,000 calorie diet. So naturally, the number of calories your body needs can vary very much between person to person. So just keep that in the scope, in consideration here, that the number of servings that you want to reach for may not perfectly match what you see here exactly on this screen. So that's the DASH diet. Let's see. So last but not least, we have the USDA MyPlate. So I love bringing this one up because, and even like my age range too, we don't know at this point that the food pyramid is actually defunct. Like, this is not a thing anymore. The MyPlate actually replaced the food pyramid back in 2011. A lot of people aren't aware of this because naturally we're not taking nutrition classes much anymore when we're, outside of grade school. But the reason why they re-envisioned the government guidelines is because it provides a much more practical application nature of how to approach your nutrition. So if we can see the food groups divided on a plate, then realistically we can try and apply that to our own meal plates as well. So I often find myself talking about my plate quite often with my patients at the student health clinic because it is easy to apply and talk about. And if you were to follow something like this, the likelihood of your body getting the nutrients it needs in the right amounts is much higher. Another added thing is that you don't need to get in the weeds, or you don't need to get too hyper-focused on what are the specific nutrients within these food groups, because if you're following this kind of structure, it's likely you're getting them already baked into those foods, right? So that's kind of simplifying things. And it's nice because it gives you food groups, but you have total autonomy and agency over what kinds of foods actually exist within those food groups. Now, there's general recommendations for how to choose foods, but it allows for a lot of creative freedom here. So that's about the USDA MyPlate. Now, this isn't necessarily something that's generally recommended for active disease management per se. However, it's wonderful for general health promotion, including heart health. So that's why I wanted to bring it up and to give you one more way to practically apply this nutrition information, because my hopes and dreams for today is that as you walk out from at least this session, you have maybe one more piece of nutrition knowledge that you can apply to your own life so that you feel more confident what you're doing is setting yourself up for better health outcomes in the future. Now, I wish I could go into more detail today, but naturally I don't want to extend this conference way longer than it should. So with that being said, I would love to show you a resource that I think would be really wonderful to access on your own time in addition for more information. So myplate.gov is a wonderful resource that has really a treasure trove of helpful guidance and tools to help you navigate your own nutrition. You can learn more about the MyPlate method here. You can figure out, the ins and outs of their helpful app. There's wonderful guides on how to manage salt intake, how to navigate the grocery store in a smart way, meal planning, really so many different topics. They also have a nice repository for recipes too. So I just want to make sure you feel like you have something you can look at even after today, and know that what you're looking at is evidence-based and not just something that a social media influencer just put on the internet and made it sound like it was real. So that's good. I was going back and forth on this concept of putting some more visual examples for how to pull it all together, because in certain ways, I don't want this to narrow the vision of what you can do with these recommendations, but at the same time, I know people love examples. So just a really small snapshot of maybe how can we apply these guidelines or these recommendations. So what you see here is basically breakfast, lunch, and dinner, and some snacks. And yes, snacks can be a wonderful tool to promote your overall health, being that they are well thought out and nutritious. And just one more slide of further examples. But again, please don't let this limit your imagination and creativity here. Moving into some of the specific topics I wanted to highlight, one of which is alcohol. Moderation is key here. I'm sure this is not the first time you've heard this. So basically what's generally deemed as safe for most people is limiting it to 1 to 2 drinks per day for men and 1 drink per day for women. Now, that's not to say you need to go out and start drinking if that's not what you're doing, but rather, if you're drinking more, this is a good thing to keep in mind to have those limits. Generally, the reason why we're talking about this in the context of today's session is because when you have higher levels of alcohol consumption, it can set you up for some more adverse health outcomes in the future, and including your heart health. So high blood pressure, elevated triglycerides and cholesterol, liver damage, and the list goes on. This is just a small snapshot. Another reason why we wanted to bring it up, I know Brian was saying, a little commentary on resveratrol is interesting here. So resveratrol, you may have heard of this before, is in red wine. It's a potent antioxidant. And, current literature, if you were to go and look at some of the more evidence-based platforms, it's pretty mixed. It's actually quite mixed. So it is really hard to tell you a firm yes or no here. It is more gray at the moment as to whether or not red wine is heart healthy or not. More data is needed to have a very firm answer on this. So what do you take away with this information is if you're not drinking, it may not be wise to just start drinking in hopes you're going to get those health benefits, because we don't know. The jury's out still. If you already do drink, maybe there could be some benefit in opting for red wine instead to reap potential health benefits, but just some food for thought there. Stimulants. So I know stimulants have been sort of touched on in today's presentations. They might even be touched on more from a dietitian standpoint. And because caffeine is so widely consumed and available as a stimulant, that's the focus of this slide for me today. In general, limiting that to less than 400 milligrams per day is deemed safe for most healthy people. So if you're someone who has questions about this, maybe it could be a good idea to actually have a more personalized conversation with your healthcare provider in case there's certain elements of your health that's contraindicating a higher level. Again, the reason why we're talking about this today is because high levels of caffeine intake may be associated with higher blood pressure, and this is especially true for those who are not used to drinking caffeine. So I use this example a lot. If you're someone who really doesn't drink caffeine, but all of a sudden you have this really stressful day and you don't have enough sleep, you drink 3 cups of coffee out of nowhere, likely you're going to really feel that in more ways than one in not a great way, and that can predispose you to a higher likelihood of higher blood pressure. But practically speaking, depending on which product you're getting this caffeine from, the caffeine range truly varies so widely. In general, 4 cups of coffee is roughly reaching about 400 milligrams. But if we're talking about energy drinks, caffeine pills, truly the limit does not exist there in some cases. So what I advise you to do is be a really conscious consumer. And if you're choosing those kinds of products, look at the nutrition label, look at how much caffeine is in it, because some of them can be much higher than you anticipate. Now, leading into our last little topic here on supplements, again, just for a moment of a breath of air here, just curious what your thoughts are on this statement, true or false. Supplements are a better way to consume nutrients compared to food. What do you guys think? Okay, all right. That was pretty unanimous. I'm proud of you all, because I would agree. So I mean, there's probably exceptions to this point, granted, right? This is not a very black and white issue, but in most cases, a food-first approach is going to get you the most bang for your buck and is in general safer. So actually, the nutrients that we get in our foods are usually better utilized by the body because the complex interplay between those nutrients, like to have the word like synergy, they increase the likelihood of the other being utilized. So that's pretty cool. Supplements often contain those nutrients or ingredients in much higher doses than your body can actually even utilize or use safely. And many people think that if it's a supplement, more is better, and that can lead us into really dangerous territory. I know it's not listed on here on the slide, but really important thing to take into consideration is that supplements are very poorly regulated from just a regulation standpoint in our country. So just because something is on the shelf does not mean it is safe, and it does not mean it is exactly what it says it is. In reality, many supplements are contaminated or have the ingredients that they say they have in levels that actually don't align with what they say it is. So you have to be a conscious consumer, choose really reputable brands, and if you decide to supplement, talk with your doctor first. That is so important, so that it's not negatively impacting your health, and so it's not negatively interacting with medications, even if you think it's generally safe. So that about wraps up my presentation today. Just wanted to highlight some strategies, overall approaches, things to look out for. I hope you're walking away with some more little practical tidbits of information.